Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello, once again, and welcome back to Better Life TV with Dr. Pinkston. I'm so glad to have you on board. And last week we had Ray Solano from PD Labs, a fantastic pharmacist up in Austin, Texas, a great compounding pharmacy, lots of resources on. And we're going to do it again. We're going to talk again. And I think last time we talked about, Ray, a common sense approach to medicine. This time we're going to turn that common sense approach toward vaccines, and probably mostly COVID vaccine, maybe how you get ready for it or what things you need to think about beforehand.
Well, that's important. You know, everything is personalized. We deal in personalized medicine. You know, that's what our business is about. And
that's right.
Everybody doesn't get the same shoe size. Everybody doesn't get the same clothes. And we think that the dosage, right? At school, it's dose per kilogram.
Sure.
Everything is not the same. Unfortunately, I think you have to understand the person that we're giving vaccines to, or any types of medicine. How healthy are they? What other conditions are they suffering from, or
immune system challenges that there are going on underneath there?
That sounds too much common sense.
Exactly.
Caught me off guard there.
Sorry. So if we are going to, you and I were talking a bit ago about how some people, and I think it's about 20% of our population, have an immune system problem, but it's not just immune system. What it is your body will overexpress inflammation. Inflammation is good. We need it. That's how we tear down and rebuild and survey and monitor everything going on in our body and fix it. But there's about 20% of the population that once the inflammation gets turned on, it's on and it goes overboard. So people think that when they have like a rheumatoid arthritis or some of these conditions, that they're immunocompromised, or an allergy, even allergies, right? That they're immunocompromised. And yes, there is truth to that, but I think their immune system has actually gone overboard instead of gone under. It's usually the medicines, I guess, that make us more immunocompromised, right? Do you agree with that?
Oh, that's exactly right. And the cytokine overexpression is the reason why does some people get the traditional flu, seasonal flu, and some people die from it, and others don't? Why do 50,000 people died 2 years ago from the flu, and unfortunately that was scary, and they were all vaccinated. But why do some people their bodies overreact? And so the cytokine overexpression is part of the vaccine protocols, so that the body can repair itself and actually make antigens and T cells, so the body never becomes immune to that virus in the future. However, some people their bodies go overboard, like you just said. So what we'd like to do is, I think when they come to you and ask the questions, I think preparing for this type of intervention or insult is a healthy thing to do.
Sure.
To get your body healthy. We exercise to stay healthy, but we don't really tune up our bodies before we do this. And I think philosophically, I think that we have to get our nutritional levels up, so our engines are finely tuned. Our antioxidant levels need to be in the right levels, because I think the trio that comes together to signal the macrophages, those important molecules of our immune system, so that they do their work. And the trio that I've been told, and you correct me, is glutathione. And vitamin D and vitamin C.
And the vitamin D and vitamin C seem kind of, intuitive to most people. Sometimes D isn't really. C is always on board with it. But what about glutathione? And you're a master at glutathione. Explain how, because I don't think most people know what glutathione is or what it does.
Well, it's Dr. Dr. Patel wrote a book, The Glutathione Revolution. Dr. Nayan Patel, and you can go on his website. You just Google Glutathione Revolution. We had a piece in that book. It explains it in detail. And it's in very simple terms. It's an amino acid that our body makes out of our liver. It's our force field for all invaders. It's an antioxidant that's regenerated with vitamin C. So you get it through organ meats, which we don't really eat very much anymore. So, that's where we get it naturally. Your body makes its own. However, its levels are decreased dramatically when you're taking prescription medications, when you're under stressful conditions. And so you have to have adequate levels of glutathione, and many times you can go and get an IV for it, and it works. It was the foundational for autistic children, for detoxifying. It's important to get rid of toxins because it's an important molecule in the liver to clear toxins. So it's important to get your glutathione levels correct. We do a patented transdermal spray.
A spray. I love the spray.
And it doesn't have it has a sulfur odor for about 20 seconds and it goes away. But
I noticed that.
Yeah.
I never noticed that, really.
But what you find is that you get blood levels equal to an injection over time. So this is simple. So now we got tools that you can do. You can raise your force fields up with transdermal, and vitamin C levels and your vitamin D levels, so that you can put your armor on. And whatever comes up. And I think what we find out, if people are properly hydrated, that they don't really drink a Mountain Dew before they go ahead and get their vaccine.
Exactly. And what a simple solution, just drink plenty of water. Because people, we don't know who is going to get sick with the first or second injection, depending on which one you get. And I think people are always very, very concerned. Am I going to get sick? Am I going to have to miss work? And, and who might that happen to? And you can arm yourself a bit before you go, and don't take ibuprofen or pre-treat with Tylenol or any NSAIDs or anything. They really suggest to do that, right? But these things you can with hydration and glutathione.
Hydration and aspirin. Don't take Tylenol. It decreases glutathione levels. People don't realize that. If you're coming after a vaccine, you get a little bit of a headache, which you will get a headache. Do an aspirin, Alka-Seltzer. Plain Alka-Seltzer is perfect. It's buffered or buffered. They still make buffered, believe it or not. It's down at the lower end of the grocery store. It is right in the corner over there. In the corner, and it's $2. So there's no marketing money involved with it. But these are the simple things that people do to hydrate themselves before they should be doing it anyway.
Right.
But it's important to put some electrolytes with that water. Is it power packs, or is it nice by Trace Minerals, and just sip on that for the week before you're going to go. So because it takes, I think it takes 3 days to get your hydration levels up, unless they're getting an IV bag. It takes a long time. Yes, it does. And people don't realize we live in a constant, dehydration state. And if we're thirsty, you're already past the point. And so you don't wait till you're thirsty, you drink beforehand. So what do, in talking about the vaccine and all, what do you think about, we have the different types of vaccines and whatnot, and we've got the flu, we got MMR, we got all that, and there's been a big turnover. And you're a pharmacist. I'd love to hear what you think about the fact that pharmacies are doing vaccines now instead of the practitioners. What are your thoughts on that? Well, we're a nationally licensed pharmacy. We customize medications for patients all through the country, and we want to service patients and take care of their health. We don't do any vaccines. It's not our specialty. We don't run a medical clinic, but it's not something that we're equipped to do, because we think that should be done by a practitioner, because it takes time to get the information on the patients and to educate them.
Right.
And it's not a jab and go. You have to, people do get reactions from medications, injections. We don't think pharmacists are equipped for that. We don't think that the reimbursements, I don't understand why they do it, because the reimbursements, they're not there.
Are so low. It is. Even for a practitioner, it's hard to.
And the cost, you have to do it 6 months in advance. So I don't think there's an incentive to be an injection as a loss leader to get patients to come to a pharmacy.
Yeah.
I mean, I think that people spend more time getting their oil changed than they do getting an injections. So I really do. I mean, they go through everything about your car, then they do get an injection that could possibly leave you. Some people get ill for a week and they go, well, what happened? I don't know.
Right. Then you call your doctor, and I have no information. I have no lot numbers. I have no, I don't know where did you go? What did you do? And I have no clue, right?
And so I'm not a big fan of it. We've never done it. I just think that pharmacies should stay in their lane. There's a lot of areas that they can do a lot of health with, and give prevention help tips, and also some things that they can do for getting the body ready for vaccines. That's what we really come up with. But I think there's not a shortage of practitioners that can give vaccines out of their offices.
Right.
I don't think.
Well,
unfortunately, I think they should not be charged for it if it's going to make such a big impact on the world. But you know what? I think
right now they're going through insurance, but private pay hasn't had to do that yet. But I haven't been able to get the COVID vaccine at my office. It seemed when it came out that it went to all the big place. So HEB, grocery store, got it, and I love HEB, but they got it. Walgreens and CVS, and they were all able to just hit. And I know they're a large industry. They can take on larger numbers of people rather than my little office. But at the same time, this was a new vaccine. Nobody really understands it, or what the reactions were going to be, and so people drive up in the car and poke and gone. I'm not even sure they waited there 15 minutes. Seriously, and so I just really felt like I felt that I was not able to serve my patients well, that as their doctor, I wasn't able to even get the COVID vaccine to help my patients and help them prepare. And, I didn't even get the opportunity to help them, learn how to hydrate or what vitamins to take, because they weren't in my office. They just went to the pharmacy and got it done. And nothing against pharmacists in doing these things. It's wonderful. It's a wonderful service if it's handled appropriately. And I'm not sure that it always is handled appropriately. And I know it's a big ticket item. And so, we can go into the politics and whatnot behind it, which we won't.
There's very little.
Yeah, it's just the resource is just not out there for me. And I quit as a practitioner. I actually quit doing vaccines at my office altogether, because we would order the bunches that I would expect, and every year it dwindled as they go to the pharmacy. I would throw away thousands of dollars in vaccines. It's just like, well, I give up. That's it. You got it. So I give in. It's crazy, right?
It's crazy, but I think it's really important, that intake form.
Right.
If you go to a pharmacy, it's a lot of, there's like I haven't seen it, but it's about 3 or 4 pages of information that is given. You have to sign a document and they have to keep it on file.
Right.
I have the patients that we deal with have a hard time understanding what's on a prescription label. That's this big.
Right.
Okay.
And the writing is 3 pages.
And to explain that they're going to go through 3 pages of side effects or intake and understand the risks in the 3 minutes that they're talking about. I don't think they even have read any of those documents.
Right. No, just sign and go.
They just sign and go. So I just think that it's a medical intervention. Take the time. Ask a lot of questions.
Yes.
Okay.
Yes.
Ask a lot of questions. Our tagline is take responsibility for your health. Remember, you have a choice in healthcare. So we want people to ask questions and spend the time with their practitioner. If you're doing it in a pharmacy, you know what? ask to spend some
Could
time.
be anybody. And, when I sit down with patients, I've known some of these patients for 20 or more years, and I know them very well. And I know who should get it, who shouldn't. When you go to the pharmacy, it could be anybody and you don't know them. And so that's where, again, I think it being in a practitioner's office is a lot more helpful. And so, we are at the under 2-minute mark. Can you believe that? How fast it goes? Drives me crazy. So I want you to give your website for me, Ray, about where we can find you so that people can look for glutathione and all these great products that you have.
Well, check out our website. It's pdlabsrx.com, pdlabsrx.com, a prescription dispensing labs. We're in Cedar Park, Texas. We have a phone number, toll-free number, 888-909-0110. And our website's got a lot of health tips. We record new health tips every week that's on SiriusXM. We also have a podcast, Healthy Choices XM. And our online store has our transdermal oral GSH glutathione.
Exactly.
And you know what? We have free samples of we have it is our Opti Meal shakes, the best taken shake. So if you call up and you listen to the show, Better Life TV, we'll give you a free sample of our Opti Meal shakes. So
thank you.
Well, we are do to get the word out.
You got it. And that's all of this information is on my website, drpbetterlife.com. So you can go find it there. So we're going to come back. We're going to talk a little bit more about vaccines and boosting up your health and preparing. So we'll be back in just a few minutes. Welcome back. Ray and I were just talking about my little theme music there. That was actually written by my 19-year-old daughter who will be 20 next month. So yes, I am an old woman. So welcome back. I'm talking with Ray Solano from Pharmacy Solutions PD Lab, up in, why did I do that? Up in Austin. Can't we redo that? I'm sorry. I don't need to say Pharmacy Solutions. I didn't mean to do that. That's up in Dallas. So let's erase that. I don't want to do that.
Oh yeah, I know them.
Sorry. Yeah, I know, Tom. I do my estrogen pellets with them, but that's all. So I don't know why I said that. Hey there. Welcome back. I am with Ray Solano up at PD Labs up in Austin, Texas. And we have been talking about COVID. And so I know you have something that's very important to you, near and dear to your heart. And that's post-COVID syndrome, the long haulers. Tell me what your thoughts are.
I think it's really important for people to realize that there is a condition called long haulers, that when people have had COVID, right. And sometimes it may be when they've had COVID in the injections for vaccines, but they've had these side effects after the fact. And many times it's fatigue. What we find when people do have full-blown COVID, it's the most exhausting feeling that they can't get off the couch for a week. It is extreme fatigue is one of the hallmark signs of it. Right. Well, sometimes they don't ever get back to their normal routine at all. They can't function a full day. So that fatigue is really important that they don't get back. And then also it could be persistent headaches. Or it could be brain fog. This is the big one that we see. And it happens to people that have very high intensity occupations that require them to be sharp, to be able to process multitasking, and they can't get through a day. And it's sometimes devastating. So that when they get that brain fog that occurs. And then the other thing is panic attacks or anxiety, because we do know that the spike proteins in COVID affect the brain and neurotransmitters. And we're seeing a higher incidence of dementia for these patients. So we have this whole list of post-COVID conditions.
And we're still figuring it out. There's more popping up all the time. So, yeah.
And the point is that we want people to don't think they're going crazy, because nobody's going to be able to listen, to come to a practitioner like yourself, to be able to listen to their symptoms and be able to, we may not be able to reverse them, but really make a huge difference to improve those symptoms. Because unfortunately, this may go on for 3 months, 6 months. These palpitations to the heart, I mean, I don't know. We don't know, but you'll be able to make sure we don't layer more drugs on top of it.
Absolutely, because like you said, patients with panic attacks will get more medication, and that's not really the underlying problem. It's not an organic problem. It is neuroinflammation, which we talked about before. And you have RG3 now, the synapsin that I used on a lady this week who was in the process of losing her job over, that being unable to multitask and the brain fog, and she was about to lose her job. So we found it, we diagnosed it. I've got her on the synapsin, and hopefully we're gonna improve from there.
Well, it makes a big difference in stopping those Pac-Man in the brain, those neuroinflammatory cytokines. So what we find is it increases the energy source in the mitochondria. These are natural products that delivered in a nasal spray is able to get absorbed through the vascularity of the nasal passages, and it works fast.
And straight up
there. Straight up, and requires a prescription, and people that are trained like yourself, because as all prescriptions require tapering to the right dosage for the right patients, the right strengths. But it does help a lot of patients to get their brains functioning better. And so they can start to think, because we don't want people to use traditional antidepressants or stimulants, because that doesn't fix to the root cause of the problem. So come into your office, they can say, yes, I know what you're talking about. And people will go, oh, finally somebody hears me, right?
Yeah, that's right. I hear that a lot. So, we are going to have about 2.5 minutes here, Ray. So what is, if somebody wants to get synapsin, can you just get it from any physician? Do all physicians know about this?
Well, we're the original patent holders. Jim Laval and myself put this formula together, and Jim's ideas, and we've been able to formulate it so it's stable. And we license it to all pharmacies around the country so that we want to get the word out. However, a lot of physicians are not familiar with it. They don't look it up so they need to understand it, so they can give us a call. We can find a practitioner that's familiar with it, or you can talk with you as well. But we're there to answer your questions. We just don't want people to suffer. If we got answers to people's health issues, we want to spread the word. And that's why we're doing today's show. Let people know, guess what? We got some answers for them.
That is so true. So yes, that is why we're doing today's show. And I have known about RG3 and synapsin for several years now. I absolutely love what you guys do up there. Jim and you and Andy Heyman, all you guys are fantastic. So I know you're getting ready to open up a wellness clinic and do some great things up there. So stay tuned, because we're going to be talking about that. So as we kind of wrap things up, got about a minute left. I want you to know that you can find Ray and all the information regarding PD Labs and a lot of great resources and education you can go to my website and find the link for PD Labs and the phone number and everything. And my website is drpbetterlife.com. If you haven't been on there yet, I've got a blog, I've got links to the YouTube and all Apple Podcasts and all. And you can also find the Healthy Choices Network, where Ray is there educating the world and trying to get us on our feet about how to handle such things as the long hauler or post-COVID syndrome. So, Ray, thank you so much again for being with me today.
My pleasure.
I always appreciate it. It's such a pleasure. So, guys, have a great week, and I appreciate everybody being on. Subscribe, share, get us out there.
Yes.
Thank you very much.
Bye.